Thank you very much, Anne-Marie. Our final speaker is Cherie Miller. She's the Director of Community Health at Regent Park Community Health Center and has been practicing in the field of community health for the past 20 years. Cherie?
Thank you. I wanted to tell you just a little bit more about the vulnerable populations that everybody has talked about and why it's so critical for us to have the information from the long-form census. Community health centers work primarily and sometimes only with the most marginal people in our society. Regent Park Community Health Center works with people living in extreme poverty. We work with new immigrants, people who've been here for a while but are still adapting to the country and dealing with many, many barriers. And we work with an enormous number of refugees. So the situation for our folks is the language is foreign, the stress of adapting to a new society is enormous, they're dealing with racism and discrimination, and with refugees they're dealing with a huge amount of trauma and the impact of trauma from being in war-torn countries and in refugee camps. We work with people who are homeless, they're on the street, they're living in completely inadequate housing situations, and in many, many cases we work with folks who have severe mental health issues and not, in addition, addictions. And many of the people we work with actually cover all of those bases, so they're not discrete groups. So when we say our folks don't fill in the long-form census, if you imagine, which I think for most of us in this room would be impossible to imagine, that's an assumption I'm making, what it feels like to be surviving barely with enormous stress and your health being impacted hugely by the social determinants of health we're talking about, filling a form is not going to be your priority. Surviving is your priority. And we consider the long form actually a supportive mechanism. There's translation supply. The mandatory nature actually gives our folks the chance to have a voice. So if it's eliminated, the information we need for our community health center, in addition to everything that everybody's mentioned, for all the other reasons, we do our program planning, we assess whether we're reaching the folks we need to be reaching in the way that's meaningful for them, from the communities that they come from. We make new programming based on this information. We assess the success of our old programming. So our clients, the people that we're here to serve, will not exist. They will be as invisible in our health planning and our services as they basically are in our society. So we feel very passionately as community health centers that we need this long-form information. Thank you.